A patient comes to you with chest pain and you have only few minutes to decide whether to admit this patient or to discharge. The answer lies in patient's ECG only if you know what to see in that ECG. Hi, I am Dr. Saurabh and today I am going to decode 4 such ECG patterns that are very critical in patient presenting with chest pain. These are the patterns that every young doctor must be able to identify quickly because sometimes these may be the only warning signs before the disaster strikes. So let's dive straight into it. So the first and the most important and the most dangerous pattern that one should never miss is ST segment elevation. As you can see in this ECG, there is ST segment. This is ST segment and this ST segment is elevated in 3 leads, that is lead 2, lead 3 and lead AVF. Now let's see how this ST segment elevation occurs and what are the criteria to say that this is really ST segment elevation. So now consider that this is a wall of left ventricle. And then this is the artery supplying a part of this left ventricular wall. Now there is a clot formation and the blood flow through this artery is completely occluded. Now what happens? The part of the ventricular wall that this artery was supplying, it gets completely necrosed, means the whole thickness of this wall get completely necrosed, and this then represents as an ST segment elevation in ECG. There are certain criteria to say that this is ST segment elevation. First, the elevation has to be more than 1 millimeter and this has to be in contiguous leads. Contiguous leads means certain group of leads, they represent the particular wall of the heart, like 2, 3 AVF, it represents the inferior wall, and similarly V1 to V4 they represent the anterior wall, and V5, V6 and lead V1 and AVL they represent the lateral wall. So the changes has to be in the contiguous leads, and then there has to be also the reciprocal changes. Now the second most important pattern that one should not miss is ST segment depression. As you can see in this ECG, there is ST segment depression in lead V4, V5, V6 and also in lead 2, lead 3 and lead AVF. This is ST segment depression. Now how this ST segment depression occurs? As we have seen previously, consider this as a left ventricular wall and this is the artery. Now here the occlusion is not complete, only the part of the lumen is occluded and there is a space through which certain amount of blood can flow and supply the ventricular wall. Now what happens here? The whole thickness of the wall is not necrosed, but the subendocardial part it gets necrosed, and this produces what is called as ST segment depression in ECG. In this ST segment depression, one important thing is there that one should not miss, and this is this. Here you can see there is an ST segment depression in V1, V2, V3 and there are also tall R waves. This is a pattern that is seen in posterior wall ST elevation MI. When we place the chest leads, we place it on the anterior wall of the chest. But if there is a myocardial infarction of the posterior wall of the heart, what we see in the anterior leads, these are actually the reciprocal changes. So this pattern one should not miss. The third important pattern that we can see in patient of chest pain is hyperacute T waves. As you can see in this ECG, there are tall T waves in V1, V2, V3. This type of pattern is sometimes seen before ST segment elevation is completely established. So this is an important pattern and one should never miss this in patient, because this patient can ultimately then change into ST segment elevation MI. So this is the third pattern, and the last pattern is this. This is T wave inversion. As you can see here, the T wave inversion can be seen in lead V4, V5, V6, even V2, V3, and here also lead 2, lead 3. What this T inversion represents? T inversion represents the ischemia to the ventricular wall. Means there is some occlusion in the coronary artery, but it has not been completely occluded to cause necrosis. But certainly this pattern is also very important, because this patient has to be evaluated further. And in T inversion, one should not miss this type of pattern. As you can see here, in V2 and V3 there is either a deep T wave inversion or there are biphasic T waves. What is this? This is called as Wellens syndrome. And what this represents? This represents a critical LAD stenosis. Means at this time patient is not in myocardial infarction, but this sign indicates that in the coming days there can be a big anterior wall MI in this patient. So this thing also you should not miss. So in summary, when there is an ST segment elevation, this is called as an acute ST elevation MI. If there is an ST segment depression, then there can be many things. It can either be non-ST segment elevation MI, it can be posterior MI, or it can simply be ischemia. If there are hyperacute T waves, then it represents early evolving myocardial infarction. And if there is T wave inversion, then it can be an ischemia or it can be a Wellens signs. So friends, these are the 4 important ECG patterns. ECG changes in a patient of chest pain is not just academic, but it can be life-saving. If you find today's video helpful, then hit the like button, share with your friends and subscribe for more videos, and comment me which ECG topic you want me to explain further. That's all for today, and always remember, treat the patient and not the dressing.